I'm going to talk about 7 common vitamin D deficiency signs or symptoms, but we want to be clear that these are not the only reason these things can happen. But sometimes people will know about other reasons and not realize that vitamin D deficiency might be a piece of the puzzle. So let's get into it. Welcome to the YouTube channel. I'm Dr. A. This is a patient education YouTube channel. Question that I got were, what would be some symptoms of vitamin D deficiency? Now, I want to say at the outset, we've talked a lot about vitamin D. It's a fat-soluble vitamin. It's also a steroid hormone, and it's very important to have it in its normal range, not too high, not too low, etc. Number one would be bone health issues. Now, most people understand that beyond calcium and magnesium and other minerals, substances, that bone health has a relationship to vitamin D levels. And because of actually number 2 that's going to come up around calcium, vitamin D sufficiency should be enough importance to create good bone health. So bone health issues, osteopenia, osteoporosis, bone turnover problems can be due to not enough vitamin D. Number 2 would be blood calcium irregularities. So this is global calcium metabolism. And the problem is when you have blood calcium abnormalities, you usually don't know until you have some kind of major symptom. Blood calcium abnormalities can be cramping. Leg cramps come from that, but also neuromuscular problems elsewhere in the body. Could be rhythm problems from blood calcium abnormalities in the heart, all sorts of things. And so usually if you're having cramping or dysrhythmia, etc., they're going to check your blood and they're going to check your calcium and potassium, sodium, they're going to check your magnesium, and you're going to look at your vitamin D as well. Tendon and ligament issues, and you think of these more as a soft tissue, but remember they're connected to your bones. And vitamin D, along with another fat-soluble vitamin, vitamin K, work together to have calcium and mineral flow into the bones and then not putting calcium in your soft tissues. So when you get like calcific tendonitis or other things where calcium goes where it's not supposed to, meaning tendon and ligament, that can be because vitamin D and vitamin K are not talking to each other, or they're both deficient, or one is bigger than the other, something of that nature. So maintenance of the tendon and ligament structures. Frequent infections. We talked about immune stability and vitamin D levels. Certainly there's lots of other predicates for immune stability, but frequent infections, one of the many reasons, can be low vitamin D levels. Aggravation of autoimmunity can come during low vitamin D states. A lot of times during autoimmunity, the body will need more vitamin D to help with immune modulation. And if you're low in vitamin D, among many reasons that your immune system is not going to, put up with things very well, low vitamin D can cause aggravation of autoimmunity, among other things. Anxiety and sleep issues, they can go hand in hand, and believe it or not, low vitamin D can aggravate anxiety. It can aggravate other things that are from too much excitatory activity in the central nervous system. So again, anxiety, sleep issues, etc. And then finally, generalized fatigue. And of course, there's a million reasons for fatigue, but low vitamin D can certainly feed into feelings of fatigue from one of the many triggers for fatigue in the body. All right, well, this is a short video I wanted to do just to answer that question about common silent symptoms that maybe are not so silent anymore about vitamin D deficiency. And you can take a look here at some links we'll put up to other content. Thank you. Please do like, share, and subscribe. I'll see you on the next video.